Developmental timeline. Here we are going to talk about the menstrual age and also the ovulational age because questions come upon that. And we'll see that in which duration we call the baby as embryo or the fetus. So let us draw one diagram talking about the menstrual cycle. In menstrual cycle, we have to understand that generally spoken, the menstrual cycle for the ladies is 28-day cycle, though it can be less or more than that. And we are taking the day number 1 as the first day because that is the time when she will have the last menstrual period. Now it is understood that mid cycle, that is day number 14, will have the ovulation. So ovulation happens in the mid cycle, and there is a very short window period. The fertilization should happen within 24 hours of ovulation. So when we are mentioning that the fertilization should happen within 24 hours of ovulation, we must have the zygote on day number 15. It is understood that life begins here. The day of fertilization is also the day of ovulation because the very same day the baby is coming, and this is where we will call it as ovulation age, or you can also call it as fertilization age. This is the true age of gestation, and if we calculate it, it is to be taken as about 38 weeks. So 38 weeks is the ovulation age or fertilization age. That is what we are talking about. But that is important in embryology or radiology. What about clinics when the lady comes to you? When the lady comes to you, she'll be actually telling you last menstrual period. So you have to calculate from the last menstrual period, and that is what we call as the gestational age. So if a question comes on gestational age, you have to understand that you have to calculate from the last menstrual period, and obviously there will be a gap of 2 weeks here, as you can see, and it will be 40 weeks. Let us revise once again. See, what we are telling is, in clinical practice, the patient tells you about last menstrual period, and that last menstrual period you calculate the gestational age, and that will be 40 weeks in total. That is what we call as gestational age. But then the baby is not in these 2 weeks. Baby comes here because that is the day of ovulation, and that is also the day of fertilization. The zygote will come on day number 14 to 15 within that time, short time period. So calculated from there, if you are talking about the age, which is 38 weeks now, is the ovulation or the fertilization age. So be careful about these terminology. Now we will make another diagram, and in this diagram we are telling that we are calculating the age of the baby. Say this is week number 0, this is week number 3, this is week number 8, and that is week number 38, because we are talking about ovulation age or fertilization age here. So if it is week number 3 to 8, that is the point where we are calling it as the embryo. Embryo is week number 3 to 8. Then what is before that? What is before that, you call it as pre-embryonic stage. So pre-embryonic stage will be week number 0 to week number 2. What about the week number 9 to week number 38 then? That is what we are calling it as the fetal age. So that is the fetal age. Let me revise again. If it is 0 to 2 weeks, you say pre-embryonic stage. Embryo is week number 3 to 8. Week number 9 till week number 38 is the fetus. Now remember that cardiovascular system is the first to gain functional maturity, and a question comes when the heartbeat begins. You have to remember that the heartbeat begins somewhere here, week number 4, more precisely day number 22. you can detect that by transvaginal ultrasonography. So, to revise, CVS is the first system which gains functional maturity as early as the week number 4. More specifically, day number 22, the heartbeat begins, and you can detect the heartbeat by doing transvaginal ultrasonography.